all of the hormones are important for our brain. Estrogen is like a natural antidepressant. Progesterone is like a natural anti-anxiety. And testosterone is a mood stabilizer.
Welcome to Wellness, your ultimate guide to unlocking your full human potential through biohacking. I'm your host, Ashley Daly. I'm a certified sports nutrition coach, former personal trainer, and Pilates instructor, and I have a degree in kinesiology. My goal is to help you improve and elevate the quality of your life. When you leave a review, it makes a positive difference. Whether you're listening on Spotify, watching on YouTube, or listening on any other streaming app, it helps listeners just like you find this hidden health information faster. You spend 1/3 of your life in bed, so the material you sleep on matters. Traditional mattresses are made with synthetic materials, chemicals, and even fire retardants. Your body should be able to rest and relax, not breathe in harmful toxins while you sleep. I also would never dream of sleeping on a mattress made with metal coils. The bed I sleep on is made with GOTS certified organic cotton and wool, and it feels like heaven. To find out which mattress I breathe better on, visit ashleydaly.com/mattress. That's ashleydaly.com/mattress. Do your feet ever ache after a long day of walking, or do you ever get a sharp pain up through your foot? I used to feel that way too, until I switched to a zero heel drop shoe. Peluva gives you the most authentic barefoot experience, and you can feel the difference. The secret is the 5-toe design, which allows for the correct dynamic movement of your foot. Whether you're a hiker, gym goer, or just someone who spends time on your feet, you have to try Peluvas. Visit peluva.com/ashleydaly. That's peluva.com/ashleydaly. Today's guest is Dr. Deb Matthews. Dr. Deb is a best-selling author, international speaker, and mom of 4 boys. She's passionate about helping you restore your health by addressing the root cause of your symptoms, especially hormone imbalances. She became a hormone specialist after she personally felt the symptoms of perimenopause, including irritability, exhaustion, not sleeping well, and even weight gain. Dr. Deb uses scientifically based treatments to help her patients reclaim their energy, boost their libido, improve their mood and memory, and even help you lose weight and get back to feeling like yourself. She's a true leader in the world of hormones. She's a diplomat of the American Board of Anti-Aging and Regenerative Medicine, and she even tests other doctors for board certification. She's lectured globally, sharing the stage with Suzanne Somers at Harvard, and she's dedicated to shifting medicine towards creating genuine wellness. Dr. Deb, welcome to Wellness.
Thank you so much. It's great to be here.
I'm so excited to have you on the show. Can you give us an overview of birth control pills?
You know, birth control pills are important because we want to be able to plan our families, but birth control pills are not really all that we think that they are or would want them to be. Really what they are is medicine. They are chemicals that mimic our hormones in order to change how our body functions, but they're not actually made out of real hormones. They're made out of synthetic chemicals, and they have some side effects and some things that I think that women really need to know about. One of those things is that it really lowers libido because birth control pills work to lower testosterone levels. And that's not really the intention, that's a side effect. Although a lot of times, we actually do use birth control pills in order to help for women who have acne. The reason that it helps for women who have acne is because it's lowering testosterone. But testosterone is really important for interest in sex. It's important for lubrication and arousal. It is important for keeping our muscles and our bones strong so that we don't become a frail little old lady. And when you're in your 20s and your 30s, you're still building bone, and you need testosterone to do that. So it can have long-term implications. The way that the birth control pills work is they shut off our own natural hormones and replace them with these chemicals. And we assume that when we're ready to start a family and we go off the birth control pills, that our hormones are just going to kick back in, but that's not always the case.
Oh, okay. Such a good explanation. And you touched on so many things. Where I want to go from here is your story, because your story relates to birth control.
Yeah. Well, I went on birth control pills when I was, in my late teens, early 20s, and I was on birth control pills for, many years until I was ready to start my family. And I had had about 10 years at this point, symptoms of being tired all the time, being cold all the time, struggling with my weight. I had this limp, dry hair, but I didn't understand what was going on. I had an enlarged thyroid gland, and I had already been to the doctor twice because somebody looked at my throat. A doctor looked at my throat and said, "Your thyroid is enlarged. You need to go get that checked out." And when I went, my thyroid tests were normal. And so, I just thought everything was okay. Well, when it was time for me to start a family, I had it all planned out at the end of my medical residency. I went off the birth control pills and nothing. I never got a period. I didn't used to get my period before I went on birth control pills either. But when I went on the birth control pills, it caused me to have a period every month. And so I thought that everything was okay. But of course it wasn't. The problem that I had before was still there all those years later. It had just never been addressed. And it turns out that eventually my thyroid labs went out of range and I was hypothyroid. So presumably, like all these years, it had just been kind of gradually growing until finally it got bad enough. I was able to get pregnant. I have 4 boys, but for a lot of years, the problem, was just kind of pushed down the road and it was never really addressed. And the birth control pills just masked the problem. They didn't fix it.
I'm really glad you shared that story. I'm sorry that happened to you. I also feel like sometimes our story becomes our purpose. What can we do if we're ready to start a family, but we're not quite sure where to start?
Hopefully, toss the birth control pills. Periods are going to come back. And if your period is coming back and it's regular and you're feeling okay, you really do want to think about taking care of yourself before you're going to get pregnant, because you want to go into the pregnancy with the healthiest version of you possible, right? In order to have the healthiest baby possible. It does sometimes take a couple of months to get birth control pills out of your system. Sometimes it can take just a little bit to get your periods back up and running and getting the ovulation going again, because of course the whole purpose of the birth control pills is it shuts off ovulation so that you don't get pregnant. And it can take a couple of months. But if things aren't coming back, if you're not having regular periods, sometimes you can get the home tests now to test for ovulation mid-cycle. Honestly, I did that. I went and I bought those strips and I did the tests, and I called the company and I said, "Your strips aren't working. Like, it's not showing anything." It really hadn't even crossed my mind that I was the problem. I
Oh.
literally called the company and told them their strips didn't work.
Oh my gosh. Why do you think a period is a vital sign?
It is a sign that everything is working as it should be. So if we flip it the other way around, if you're not having regular, normal-ish periods, that's a clue that something is wrong. Whether you're skipping periods or whether they're just coming a lot farther apart than they should, or they're just super irregular, or they're super light, maybe you just barely get any spotting, or the worst is like if it's a really heavy, or they last a really long time. If you have a lot of PMS symptoms, like all of those are signs that something is not right. So having a normal, regular, healthy period is just a sign of good health.
That was kind of a tip of the iceberg for what I really want to get into, which is, all right, we've started our family. We're maybe mid 30s, mid 40s, but now it feels like puberty in reverse. So, what are these symptoms, Deb?
So the word that we use for this time in our life is perimenopause, literally just puberty in reverse. And it is a whole time period. And lots of things are changing in our body and they're happening gradually over time. And it's really confusing because sometimes it's not obvious that these are hormonal changes and there's no definite start date. And there is kind of a definite end date, which is 12 months after your last period. But a lot of the symptoms are confusing and women don't recognize what's going on. And therefore, we don't find the right solutions. And another really big problem is because all these different changes are going on, and if we don't really have a medical problem, like we're not exactly sick, this isn't a disease, 100% of us, 100% of women are going to go through it. But a lot of times doctors sort of dismiss us when we come in and complain. I think that's why it's so important to have these conversations so that women can understand what the heck is going on. Because if you go in and complain about all these things that we're going to talk about, all these symptoms, doctors will often tell you you're too young to have a hormone problem, or that's just normal, or you're depressed, or here's a sleeping pill, or, we get brushed off. To be really honest, it's not your doctor's fault. We were not taught about any of this stuff in medical school. Like, we were taught how to prescribe birth control pills. But we really weren't taught anything. I don't even remember the word perimenopause. I'm sure they must have said it, but like, we weren't taught about any of this stuff. But so the things that start to change when we're kind of in our, late 30s is our progesterone starts to go down. That's the first hormone that tends to decline. It's progestational. It's one of the ones that helps us get pregnant. And that's why it gets harder to get pregnant when you're 35, 40, 45. But progesterone is a calming hormone. It helps us feel chilled out and relaxed, and we can sleep soundly through the night. So what changes for us is now all of a sudden we're waking up at 2 in the morning, 4 in the morning, staring at the ceiling, wide awake. And then, of course, your mind goes, right? Like, all the things you got to remember. You're doing that list in your head, or you're thinking about all the things you got to worry about. And when we don't sleep, nobody feels good the next day. So sleep is a huge one. And of course, what happens? You go to your doctor and you complain you're not sleeping. So you get a prescription for a sleeping pill, but it's kind of like the birth control pills band-aiding over the problem. It's not fixing the real problem. But not sleeping is super common. And night sweats is common too. Like, a lot of women will start to have night sweats. It tends to be that week before your period. And then once your period starts, and the night sweats kind of go away, and then they come back again the next month. And a lot of women that I talk to haven't made the connection. They'll know that they get them sometimes and not others, but they haven't made the connection that it tends to go with their menstrual cycle.
There are so many things that I want to ask you, but also I just want to share my personal story. A few years ago, I started to feel like I was going crazy. My mood was up and down. Bless my husband's heart. He was like, I'm so on board with like any doctors you want to see, anything you want to do. But I'm also for advocating for your own health because, like you said, doctors weren't taught this. It's part of the reason I started my podcast so I could share this information, because I found out what perimenopause was because of my digging for these symptoms. You had touched on some of them. Can you please mention more symptoms?
Mood is really, really big. And I kind of have a similar story to you. Like, I can remember one time, it was Christmas, and we're having this Christmas party at our house. We were having friends over, and I went running, screaming out of the kitchen, and I left my husband and my kids like with their jaws open, like, what the heck is wrong with mom? And I ran into the bedroom, slammed the door, and I'm like sobbing on the bed with snot coming out of my nose, like, just completely lost it over trying to decide what we're going to serve for dinner. Like, it was just the stupidest situation. But in the moment, it was like this big old deal, and my brain just couldn't handle it. I also have this totally unscientific theory that, there's all these Karens running around out there doing crazy things and saying stupid things and getting themselves into trouble. And if you think about it, these Karens are often women kind of midlife. I kind of think they're kind of low on progesterone because it's the calming hormone and helps just keep us chill. So when progesterone is kind of in short supply, we can get more irritable, impatient, negative, critical. Like, sometimes in your brain, you know perfectly logically well that that person, whatever they're doing, your spouse or your kids or whatever, it's really not that big of a deal. But you can't help feeling like this because it's just so irritating, right? Your spouse chews too loud, or your kids are talking too loud, we just have no patience. And it's confusing, like, why are we behaving this way? But it's a really common experience. Another really common experience is anxiety. So one of the symptoms that I had was I was waking up in the middle of the night with panic attacks. I'd never had anxiety before, thank goodness. I was fortunate. But all of a sudden I would wake up in the middle of the night and it was hard to breathe, and I felt like I was having a heart attack, and it felt like I was going to die. So I was grateful that because of my medical training, I understood what it was. But even understanding what it was really scary. I can't even imagine how scary it would be for somebody who didn't know what was going on. And there wasn't anything to be nervous about or anxious about. Like, it wasn't like it was, sometimes it's good. We're supposed to be anxious. There's something, really bad happening. That's just appropriate behavior. But when you have anxiety for kind of no good reason, or you're really worked up over something and everybody else around you is going like, what the heck? Like, calm down, those are all clues that, maybe something's going on with your hormones.
We could share stories all day. You had touched on a good point. Heart palpitations, and I've also heard lumpy breasts can be a sign of
Yeah.
perimenopause.
Well, so estrogen makes things grow, makes your uterine lining grow, makes breast tissue grow, and that's okay. But when we start to lose our progesterone, then we get an imbalance there and things can kind of grow more than they should. So now you can end up getting sort of lumpy, bumpy breasts. You can get heavier periods. Your periods can last longer. Becoming in better balance can really make a big difference with a lot of these symptoms. Anything to do with PMS, the breast tenderness, fluid retention, bloating, all of that can just get worse when progesterone goes down, and it can last longer. So, when you're like 21 and you have one day where maybe you're a little weepy or a little bloaty, okay, fine, your period starts the next day and you move on with life. But when those days start to stretch out, and it's 5 days, 7 days, 10 days, 14 days, like, then it's really tough. And that's when your family becomes hormone hostages. Like, everybody tiptoes around you because they never know when you're going to blow. And it doesn't have to be that way.
That's my favorite thing. Yes, that's what I wanted to get to. It doesn't have to be that way. What are some symptom relief mechanisms that we can implement?
If you try to go to your doctor and say, terrible PMS, more anxious, not sleeping, all the things, what we are trained to do at medical school is to write your prescription for birth control pills. And we've already sort of talked about how it's not really fixing the problem. There's a bajillion different birth control pills that have different levels of the different synthetic hormones in them. So some of them do better for some people and others. Some of them cause lots of side effects. We didn't really say, but let's just mention this too. Sometimes women get put on birth control pills and it has a lot of bad side effects with mood, energy. Like, sometimes women feel like they're enraged, like they don't feel good. And if you don't recognize that it could be your birth control pills, then, you're looking for answers in the wrong places. But so I'm saying that I don't really feel like birth control pills are the best answer for these problems, but there's a lot of things that are within our control. So one of the big causes of hormone imbalances in women is stress. And whatever's happening with your ovaries, maybe they're not making as much progesterone because you've turned 40, whatever the case may be, if we add extra stress into the mix, we're just making everything worse. When we are stressed, cortisol rises. That's our hormone that helps us cope with stress. And cortisol is so important because it regulates all our other hormones. And it's a survival hormone. We need cortisol to be alive, but we don't need progesterone to be alive. We just need it to feel good. But all the resources end up going into making enough cortisol to help you cope with the stress at the expense of some of your other hormones. And so that can just make the menstrual problems worse, the PMS worse, etc. The things that we can do to help minimize stress in our life can actually make a really big difference. If only we had a magic wand and we could just erase all of our stress, or if only Blue Cross Blue Shield would pay for day trips to the spa or, a cruise, that would be awesome. But there are a lot of things that we can do to minimize the negative effects that stress have on our body. A great example of that is gratitude, because our brain can't feel scared, angry, bitter, and grateful at the same time. We don't always have control of everything that's going on around us, but we have some control over what we think about, what we choose to think about. So if you can do your very best to be a glass half full person, to be optimistic, to see the bright side in things, to feel grateful, as opposed to the negative person who's the worrier and we're thinking about the worst case scenarios. It's simple to say that. Of course, it can be hard to do, but if you recognize yourself kind of thinking those negative thoughts, and if you can tell yourself to stop, and sometimes a helpful trick is to literally out loud say stop and even put your hand out, and that kind of breaks the pattern in your brain. And then you can choose to think about how it's almost the weekend, the sky is blue. Like, there's always good things. There's always something good that you can think about.
Oh, that was such a lovely answer. I wasn't expecting you to take that route, but I'm really glad you did. So we'll manage our stress.
Yeah.
What about bioidentical hormone replacement therapy?
Okay. We want to have healthy lifestyle habits because that's always going to be the first step, right? But when your ovaries are, over 35, they are on a trajectory downward. And if you are in your 20s and you're having some of these symptoms that we talked about, lifestyle habits can sometimes fix the problem. But at some point, there's only so much that lifestyle habits can fix. And this is when we can add back some of the progesterone. And progesterone that I'm talking about is the bioidentical progesterone, which means the progesterone that is an exact match for what your ovaries are supposed to be making more of, not one of the many different synthetic chemical versions. These are called progestins. There's all sorts of different ones in birth control pills. There are synthetic progestins in the birth control shot and in the implants. There's progestin only birth control pills, but all of those things are synthetics and they don't have the same effects. And if you think about it, the way that you can kind of remember this is progesterone is progesterone, whereas these other ones are all birth control, right? They stop you from getting pregnant. It's not the same thing. The natural progesterone is available by a prescription in a capsule, and it is available as a topical cream, which is actually even available over the counter. Typically, for younger women who are still having pretty regular cycles, you really only need it the last 2 weeks of your cycle, sometimes even only the last week of your cycle, because progesterone is supposed to go way up after we ovulate. So we ovulate in the middle of our cycle, and then when our period starts, that kind of starts the next cycle. That 2 weeks between ovulation and when our period starts is the time when our body's supposed to be making a lot of progesterone. And if it's not, that tends to be the not very good time in our month. So a really common thing for women is they start to feel better when they're on their period, when their period starts. And then that week after the period, that's the good week. That's when we're chopping our broccoli and we're going to the gym, we're cleaning out our closets, like we feel good. And then it starts to go downhill again. So those 2 weeks is when we most especially need it. Sometimes as we get older, we use it for longer than that, but it can make a dramatic difference. I just had a patient in the office yesterday who came to me. She had been put on birth control pills when she went into her doctor to complain of all these symptoms. She was having anxiety. She wasn't sleeping through the night. She just didn't feel like herself. And that's really hard to put into words, isn't it? That is the number one thing that women say when they come to see me is, I just don't feel like me. Like something is just not right. I don't know. This doesn't feel normal. One person said, I just want Lori back. But so she'd been put on birth control pills. She didn't really feel better. So then they gave her a different kind of birth control pills that had a higher dose, and she felt way worse. She was so anxious. She felt like she was crawling out of her skin. So she came to me. We took her off the birth control pills, put her on natural progesterone. And I just saw her back yesterday. She's sleeping soundly through the night for the first time, and she can't remember when. The anxiety is almost completely gone. Like she just feels like a new person. So if her doctor would have just gone straight for the progesterone, we could have missed all that drama.
Oh, she went from a Karen back to Lori.
Yes. That should be our new slogan. Don't be a Karen, be a Lori again.
I just love that example you give. It reminds me of that Shania Twain song. She forgets her purse. She's like, this could be worse than PMS. I'm like, she was going through perimenopause.
That's right.
Okay. You gave us such a good explanation on progesterone. A question that I had, because I was clueless when it came to hormones, but when I learned about progesterone, I bought a little tincture of, I think it was sweet potato extract on Amazon. I was like, I'm just going to take this orally. I'm going to rub it on myself, but I didn't really get any relief. Why is that?
We get the progesterone from soy or yam, but you can't just eat the soy, eat the yam, rub the soy on your skin. It still has to be modified in a lab in order to extract the progesterone and really be able to use it. There are a lot of wild yam creams out there that really do have actual progesterone in them. Like they've been modified and they've extracted it out, but not all. So it just, you have to, first of all, make sure that it actually says progesterone in the ingredient, in the little small print. And then sometimes it also is just a matter of the right dose. We're all different, especially if you're trying to use it topically. It works better for some people than others. The capsule, which is the one that you have to get by a prescription, The capsule gets processed in your liver. So we don't always love that things get processed in your liver, but in this case, it's actually really helpful because when you swallow the natural progesterone and it gets processed in your liver, it actually crosses to your brain a lot more than the topical progesterone does. So for women who especially aren't sleeping, if they feel irritable, if they feel anxious, sometimes the capsule form actually can work better than the topical cream. On the other hand, if you're having really heavy bleeding, if that's like your main problem, sometimes using the progesterone vaginally, so we're getting it like right up where it needs to go, sometimes there's circumstances where that can have an advantage. So there's different forms of the natural kind of progesterone, different ways of using it, different times that one might be better than another. So if you can find somebody who can help guide you through the process, it can be really helpful. But if you're kind of winging this on your own, there is progesterone cream available over the counter.
I've heard that it can be dependent on the woman.
Yeah, we are all unique. And that's one of the things that has made this really difficult for doctors. So we are trained to make a diagnosis. We have to put a label on you. Perimenopause isn't a disease process that has a treatment, so to speak. There's no antibiotic or antidepressant or whatever that is specific for perimenopause. So it kind of gets overlooked. But even if we're using hormones on women, there's however many doses of Prozac and there's however many doses of Ambien. But for progesterone cream, there's like a wide range of what people need, and what might be right for me might be totally wrong for you. And some women don't do well on progesterone. When they try to take progesterone, they have side effects. Some women are super sensitive. They can have, like, it's supposed to make all those PMS symptoms better. For some women, it makes it worse. Or it's supposed to make you feel more calm and sleep better when you take the pill. For some women, it does the opposite, it makes them feel like they're crawling out of their skin. So it has to be the right dose and the right form for the right person. And that makes it confusing both for us as women, but also for doctors who were not trained about this. Like, I was not told at medical school that there is a difference between the kind of hormones in birth control pills and the kind of hormones that my ovaries are making. It's not discussed. And how I learned about it is I read a book by Suzanne Somers. You remember her? She's the thigh
Yes.
master lady.
Yes.
Yeah. And I read her book because I was beside myself, not feeling good. My husband didn't know what the heck to do with me. And he's actually the one that found the book and told me that I needed to read it. And I didn't want to read it. I don't want to get my medical information from celebrities. Like, seriously? But I didn't know what else to do. I knew there was something wrong with me. I didn't know what it was. I had no other options.
Oh,
And it made such a big difference, changed my whole life.
that's so sweet. Thank goodness. When is a good time to start supplementing with estrogen?
Estrogen tends to become a problem later. Usually, progesterone kind of goes downhill 35, 40. By the time you're in your 40s, probably your progesterone is down. Estrogen is definitely down when you go through menopause. So menopause is defined as 12 months since your last period. So by then, your estrogen is down. Leading up to that, though, there's a lot of fluctuations. And so 1 month it's up and 1 month it's like a whole roller coaster, which is like super duper confusing. Everybody has a very different experience. So for some women, they have regular period, regular period, regular period, no more periods forever. That was just it for them. Other people, they have like a couple periods here and then they skip one and then more and then they skip one, or they have a period once and not for 6 months. Like, it just all over the map, totally unpredictable. And I heard another gynecologist describe this as, when you are in this end stages of perimenopause, your ovaries are like a bad employee. You never know whether they're going to show up for work. Even if they show up, you don't know if they're going to do a very good job. Like, you just can't rely on them. So that's really confusing. And one of the things that this leads to is there are a lot of doctors out there who don't want to measure hormones. I am one of the doctors who does. I find that it is really helpful for me to understand what's going on with your hormones. But the reason that a lot of doctors don't want to measure hormones for women is because our hormones fluctuate. So depending where we are in our menstrual cycle, our hormone levels are very different. Progesterone is supposed to be really high before your period, but it's really low while you're on your period and right after your period. And so if you're in your gynecologist's office on some random Tuesday afternoon, it might be the completely wrong time to measure your hormones. Or maybe this month we measure your estrogen and it's quite low, but next month it might be high. It is a little bit all over the map. But so is your blood sugar. It depends on what you ate and when you ate. And so we still measure your blood sugar. We just, interpret the results. Your blood pressure changes. Did you just have to like drive through traffic and be really late to get to your doctor's appointment? Or if you've exercised, like all these things affect our blood pressure too, but we still measure your blood pressure. We just take all the information, with it in order to interpret the results properly. But so usually estrogen is more of a problem for women kind of late 40s and into their 50s. And things only just get worse because estrogen is so important for women. And we're going to get to, I hope, why we're scared of estrogen, and we're going to debunk a whole bunch of myths. But for now, estrogen is really important for our heart, our brain, our bones. It's an antioxidant. It's anti-inflammatory for women. It holds moisture in our body so that we don't get dry, the dry eyes, dry skin, dry hair, dry vagina. It keeps us like tissues elastic so that we don't get so many wrinkles, so that we don't get hardening of the arteries and high blood pressure, urinary leakage and urinary tract infections. How we tend to feel when our estrogen goes downhill. Like I think the things that women think about is menstrual changes and hot flashes. And the hot flashes are super annoying. They're not really fun. But to be really honest, if hot flashes were the only thing that we had to put up with, like we would get through it. That is not the biggest problem. They can be really bad for some women, but generally the hot flashes are just annoying. Our brain doesn't work. Like we can't remember why we walked in the room and where we left the car keys. And we can't come up with the name of that person that we've like been friends with for 10 years or that word. And now we find ourselves talking about the thingamajig and the whatchamacallit. And, you can't help but think like, oh my gosh, is this early signs of Alzheimer's? Like it's scary. And we get tired and grouchy and kind of depressed and achy, like our joints hurt and we get out of bed in the morning and feel like we're 90 years old. And so let's say you got lots of aches and pains and you march into your doctor to say like, I hurt, my shoulder hurts, and you can be given anti-inflammatory pills. Like frozen shoulder is a problem that women get when they're menopausal. We have a lot of estrogen receptors in our joints. It makes such a big difference, and it is completely overlooked. Like go ask an orthopedic surgeon about estrogen and menopause. Like
I am going to share this podcast. Everything that you're talking about is resonating with me. Let's get into why are women, especially doctors, afraid of prescribing hormones and using hormones?
yeah. This is such an important story. I have to take a deep breath before I start because it is so upsetting. Like this is doctors' fault, first of all. This is our fault as the medical community. We have done the most enormous, tremendous disservice to women. When I was in medical school in the early 90s, we were taught that hormone replacement therapy was the greatest thing since sliced bread. It was going to protect our heart, our brain, our bones. We wanted all menopausal women to be on hormone replacement therapy for their own good because it was just so helpful and so important. In 2002, this giant study was done. It was called the Women's Health Initiative Trial, and it was supposed to prove once and for all just how wonderful estrogen was for women. And all of a sudden, what came from that study was that it wasn't protecting women's hearts like we thought it would. And it was causing breast cancer. And we as women are kind of scared of breast cancer. And also, doctors are scared of causing harm. Like on the first day of medical school, literally the first thing that we do on the first day of medical school is we take the Hippocratic Oath. And in the Hippocratic Oath, what it says is first, do no harm. So the fact that we were telling all these women to go on hormone replacement therapy, and then we found out that we were causing breast cancer, we as a medical community were horrified, like just horrified at this. And somehow that feeling of like just complete shock and despair has permeated into the entire medical community, and we can't get past it. So that was 20 years ago. What we know today, and I mean, I've been doing this for 20 years, but what is coming more and more to light over the last 20 years is that in that study, it actually did not show that estrogen caused breast cancer. In the study, there were two groups of women. One group of women had had a hysterectomy, and the other group of women still had their uterus. So the women who still had their uterus were given a combo pill. It had estrogen and progesterone, except that it didn't have real progesterone. It had a synthetic drug, and the kind of estrogen that women were given was from horses. So it was from nature, but it wasn't like natural to women. Um, in that group of women with that combo pill, there was a very tiny increase in the incidence of breast cancer. There was an extra 7 breast cancers per 10,000 women, a very tiny number, but nonetheless, we did see a very tiny uptick in the incidence of breast cancer in women who took that combo pill. In the other group of women, these are women who'd had a hysterectomy for whatever reason. They just got estrogen all by itself. The progesterone was done to protect the uterine from side effects of the estrogen. So if you don't have a uterus, you just got estrogen. In that group of women, not only did they not have an increase in the risk for breast cancer, they actually had a decrease in the risk for breast cancer. So this same study from 20 years ago that scared every woman and every doctor off of estrogen and off of just hormones as a blanket statement actually showed that estrogen reduced the risk for breast cancer, not increased it. Exactly the opposite of what everybody sort of knows to be true. We have never been able to come back from that. A couple of years ago, I think it might have been 2020 or 2022, the same authors, the same doctors who did the first study they've been publishing all along, trying to like take back what they said. But what they said was that estrogen is literally the only pharmacologic thing that we have that reduces women's death from breast cancer. Despite what they've tried to publish after the fact, despite any of this, this idea that estrogen causes breast cancer is so seared into the psyche of doctors that doctors can't get past it. And therefore, we as doctors are still telling women wrong information and scaring them away from hormones. And we're telling them, no, you can't have hormone therapy because your mom had breast cancer, or, whatever the case may be. And we're scaring women away from something that is so important to keep us well in our senior years.
I'm so glad you shared that story. And this is one of the reasons I wanted to have you on the show. But I was listening to this podcast a few months ago where this woman was talking about hormones. And she was saying, oh, well, I can't be on hormones because she had breast cancer. Why would someone with breast cancer be afraid of estrogen?
Just like there's hormones could mean estrogen or progesterone or synthetic, and there's all different ones. Not everybody has the same experience with breast cancer. Like some women have very early breast cancers that are found, surgery is done or whatever's done, and they can move past it. And now they're going to live another, 40 years or whatever it may be. And then other women have more complicated cases. So I don't want to make a blanket statement, but there are a lot of women out there, especially with the early, stages, and they get treated and they move past it, who are now forever told they can never, ever have hormones. The reality is that most women with breast cancer die from heart disease, not from breast cancer. Especially in the early stages, breast cancer is very curable, and there's a very high survival rate. But now they're going to go forward and they're at risk for osteoporosis and hip fractures and heart disease and dementia and urinary incontinence. I think that when we're younger, we don't appreciate what a big problem urinary incontinence becomes in older women. And a lot of times people will help care for, elderly women in their family. But once grandma pees their pants every day, like once this is a big laundry problem, it really becomes a burden to try to help care for people at home. And so this is actually a really common reason for why women end up in assisted living. It is largely preventable with hormones, but women deserve at least to have a discussion about risks and benefits. There have been 25 studies so far that have been done on women who have had breast cancer and then were on hormone therapy afterwards. And in exactly 0 out of those 25 studies were there an increase in deaths because of the women being on hormone therapy. So it's a bit of a myth that the hormones are really harmful. So everybody, has to take their own personal history into account, but at least there should be a conversation about the risks and benefits. There's a lot of misery for women who've had breast cancer, partly from just having to not have hormone replacement therapy, partly from having to have the kind of hormone treatment that shuts down your hormones and like throws you right into menopause. There's a lot of side effects from some of those treatments for cancer that shut down our hormones. And so at least women deserve to have a conversation. And there's a really good book that I would really recommend for women who have had breast cancer who kind of want to dive into this deep controversial pool.
Yes.
And it's called Estrogen Matters by Avrum Bluming. He's an oncologist who goes through all of the science. And that's a really great place to start, because 100% guarantee if you just walk into your doctor's office and say, hey, I heard a podcast, I can actually have hormones after all, that's not going to go well. But this actually gives you the science behind it. And it would be a great book to gift your doctor if you had to.
Oh my gosh, thank you for that. I read that book a few years ago as soon as it came out. So I'm really glad you shared that recommendation. And I also appreciate that it's not just a blanket statement. I want to go now deeper into a lot of those symptoms that you mentioned: frozen shoulder, UTIs, why women end up in a nursing home, brain fog.
Always the first answer is lifestyle habits, eat healthy, exercise, manage your stress, get enough sleep. When our ovaries check out, like at some point your ovaries are going to quit and they're not going to come back. While you're kind of in this perimenopausal process and your ovaries are sputtering and your estrogen is kind of up and down a little bit, there are herbal things that can take the edge off of symptoms. So there's things like black cohosh, maca, and so they can kind of take the edge off of your symptoms, but they cannot replace estrogen. There's no herbs. Once your estrogen is done, once your ovaries are finished, there's no herbs that can compensate for that anymore. But estrogen replacement therapy can make a really big difference. The best time to start on estrogen replacement is early, like right around the time of menopause, not once you've been past menopause for a long time. So I want to talk about that in a little bit. But if you are going to be on some kind of hormone therapy, again, we want the bioidentical, the natural form of estrogen, exactly what your ovaries used to be making, and they're not making enough of it anymore, as opposed to one of the many, many different synthetic chemicals. When you swallow estrogen, it gets processed by your liver. And in progesterone, that was okay. Estrogen, there's more controversies here, because when you swallow the estrogen and your liver gets the whole day's dose all at once to process, it actually increases the chance of having a blood clot. When you use the natural estrogen pills, it's not as much of a risk as the synthetic estrogen pills. But if you use the estrogen topically, it comes as a cream, it comes as a patch, there's all different ways that we can do it through your skin, then we don't get that whole, day's wallop of your liver, and we don't see the increase in the risk for blood clots. The challenge that we have, going back to some of these controversies, is all doctors seem to think that estrogen causes breast cancer, but also all doctors are aware that hormone replacement therapy causes blood clots. Well, if we give that hormone pills like we did in that study, yes, it can increase the risk for blood clots, especially for older women. If we use the synthetic progestin and we add the estrogen in the pill at the same time, that has greater risk than if it was just estrogen by itself. So the pill that we were giving women in that study was the worst one of all in terms of blood clots. But we know how to do it without increasing your risk for blood clots. We give you the natural form of progesterone, even in a pill, and we give you estrogen through your skin, and then we don't have to increase your risk for blood clots. But a lot of women are told that they're not a candidate for hormone replacement therapy because of they had a blood clot in their calf at some point, or they had some kind of a blood clot, or migraine headaches. Women who have a history of migraines have a greater risk for stroke in later years. I used to get migraine headaches. And so sometimes they're told they can't be on hormone replacement therapy because of the risk for blood clots. But that is 2002 information. Like, we know how to do it without increasing your risk for a blood clot. We want to start when you're younger, close around the time of menopause. We want to do it with the natural form of the hormones, and we want to do it in a way that is not going to increase your risk for blood clots, because we want you to have all the benefits of the hormone replacement therapy. There's no need to put up with those risks and side effects.
What's the difference between estradiol and estriol?
So estradiol is the strong one that is the main one that comes from our ovaries. And that's the main one that keeps our heart and our brain and our bones strong and healthy. Estriol is a much weaker estrogen. It's made out of the other estrogens. It's the one that we get tons of estriol when we're pregnant. But estriol is a little bit breast protective. But estriol is also really good for our pelvic floor. So vaginal dryness, urinary tract infections, painful sex, those kinds of things. Estriol actually works really nicely, and also really nicely on our skin. So if you got fine lines and wrinkles and kind of dull skin, estriol on your skin can make your skin more glowy and just stay healthy. healthier.
Would you recommend one of those estrogens over the other or a combination of the first two if you're going to replace estrogen?
I do it both ways. There are a lot of estradiol products that are FDA approved. There are patches, there are estradiol pills. I tend not to use the pills just because there's a small increase in the risk for blood clots. There are gels that, have estradiol. There's vaginal creams that have estradiol, but that's the primary estrogen that we really need in order to replace what our ovaries used to make. If we go to a compounding pharmacy, which is a specialty pharmacy that personalizes the prescription for you based on a doctor's prescription, we can actually do a combo cream that has estradiol and estriol. And especially if we're going to use the cream vaginally, the estriol is really helpful. Sometimes we use a combo cream and sometimes we use the estradiol. When I first started practicing, I used to use a lot more of the combo cream, and it was mostly estriol with just a little bit of estradiol. I have to say that over the years, my thinking has really changed on it. It's really the estradiol that has the beneficial effects on our heart, our brain, and our bones to a much greater effect than the estriol. And so I'm mostly interested in the estradiol. And then part of the reason that we liked using this estriol is because it hinders breast cell growth, whereas estradiol can promote breast cell growth. But because the studies aren't really showing that estradiol is causing breast cancer, I'm not so worried about that. So sometimes I use one and sometimes I use the other. But over the years, I have to say that I'm more leaning towards using more estradiol and less estriol. But there are certain circumstances. So for example, somebody who has had breast cancer, estradiol, if you have breast cancer right now, active in your body, but hormones are not the right thing for you. But after breast cancer, if you're interested in trying to get rid of the vaginal dryness, etc., estriol is a great choice because it works really nicely. And we don't have to worry that it's going to cause breast cancer cells to grow. So it's a nice choice.
Thank you for explaining that because I have a mixture of the combo and I was like, ooh, I wonder what Dr. Deb would say about it.
Yeah, it's fine.
I've also heard in a different podcast, depending on your partner, you should, if you're going to use estrogen vaginally, that you should wait 2 days to have intercourse because you can transfer it to your partner because it can stay down there for a while. Have you seen that?
I don't tell people to wait for 2 days because for hormone replacement, you're supposed to apply it every day. So like you'd never be able to have relations. Once, if you applied the cream and then the sparks flew and, romance happened, then yes, your partner, could get in contact with the cream. And one time, it's not really going to make a difference. If it was like a regular thing, it probably wouldn't be the best. What a lot of women will do is get up in the morning and pee, apply the hormone cream. Because we actually usually tell women to apply hormone cream to the labia because it's absorbed really well through that mucous membrane tissue. Put it on in the morning and then you have sex at night, you should be okay. Or, if there's a few hours in between, you should be okay. So where we worry about it a lot more is men who are on topical testosterone gel. If their topical gel rubs off onto women and children because they have such a big dose of testosterone, even if a little bit rubs off on a woman, that could still be significant. For us, we're using fairly low doses of estrogen. So if a little tiny bit rubbed off on a man, it's not like the end of the world. It's not quite the same risk.
Okay. Earlier, you had mentioned progesterone is what we use for the last 2 weeks of our cycle. When should we use estrogen if we're starting to supplement with it?
If your estrogen is, gone down and we're going to supplement, generally we do it on a daily basis. There are some doctors who will have you skip a few days at the end of the month because when you're on your period, your estrogen and progesterone levels drop. And that's what triggers the period to happen. So there are some practitioners who have women take their hormones for most of the month, but then skip 4 or 5 days at the end of the month and start it back up again. Not all doctors do this. Some doctors just have you just take your hormones every day because you're not cycling anymore. And we're not giving you so much hormones that it's the same as, when you're 21. Generally, once you're through menopause, though, you can just sort of take it daily.
Let's go into that path of life. So you haven't had a period for a year or 2 or 10. Is it safe to start bioidentical hormone replacement therapy?
Yeah. One of the patients recently said she was so confused. Like she's a few years past menopause and she's coming in because she didn't feel good. And she was saying, like, I thought menopause means you have a few hot flashes, they stop and it's over and you're done with it. But like if only that was it, because things kind of just tend to go downhill. That time in our life, around the time when our ovaries stop and our periods stop, that next 5 to 10 years is a really important time for women because our bodies are very inflammatory. There's a lot of changes that are happening. Like the rate of decline of our body is kind of steep. Eventually, it's going to level out a little bit, but that's a really important time. We want to start the hormones within the first 5 years, or at the very least within the first 10 years of menopause, because the way that these hormones work is they are preventive. So they are protecting your heart, they are protecting your brain, they are protecting your bones so that you don't have as much deterioration and decline. If you don't start on hormones, and then, when you're 70, now you come in and now you're interested in talking about hormones. We've had 20 years without the hormones of all these things going on. We can't go back and erase all of that. So I'd really love to have the chance to talk about older women, but for the moment, the best time to start on hormones is within the first 5 years of menopause. That's where we really get the most protection. So the studies show that when we start early, we have less heart disease, significantly, like 50% less heart disease. Some studies show 50% less dementia. We live longer. We have less osteoporosis. We have less hip fractures. It just makes a big difference. You don't have to spend your time in the Depends aisle at the grocery store. Like, sex doesn't have to hurt. Your brain can remember what you're supposed to be doing. So many women feel like they get ADD. They go through this process, but you don't develop ADD when you're 50. You would have had it since you were little. So it's just your brain's not working. We can prevent a lot of these things. And that really is the best time to do it, is starting early and going forward.
Why are hormones so important as we age?
Hormones are keeping us healthy. Back in the day, before 2002, when the study changed everything, we wanted women to be on hormones, and we just let them stay on hormones for as long as they wanted, because we knew that you only get the benefits of the hormones while you're on them. And then when you stop the hormone replacement therapy, then the aging process picks up. You're still somewhat protected. So let's just say you were on hormones for however many years, and then you stop the hormones, you're still better off than having not been on them at all. But because that study came out and told their doctors, and it's the doctors who told the women, but that it was increasing the risk for breast cancer, all of a sudden, doctors didn't want to prescribe hormones. Medical schools stopped teaching doctors how to prescribe hormones. Like, there's literally the last 20 years, doctors didn't learn how to deal with menopause. So if we don't start on the hormones early, women are told that they can't have them. We are also telling women that they should get off them as soon as possible and only take the lowest dose for the shortest amount of time, right? Like, it's being treated as though it's something really dangerous and risky and harmful. And so if you're really miserable, okay, fine, we'll give you a little bit, but then we want you off it as soon as possible. I have lots of patients who come to me because they were on hormones, they felt great, everything was fine. And now their doctor said, because you turned 60 or because you turned 65, I'm not going to prescribe it for you anymore. You have to get off. But that's actually a myth. The North American Menopause Society, now they're just called the Menopause Society, back in, I want to say 2018, but they published a position statement that said there is no science to say that a woman has to stop her hormones just because she hit a certain birthday. We know that the hormones have tremendous benefits. And even if we go back to that study that said that the women who were on that combo pill had an increase in the risk for breast cancer, that was just a little tiny risk. Even so, they had less colon cancer, they had less lung cancer, they had less hip fractures, they had less osteoporosis, they were less likely to die. You lived longer on the combo pills that cause the breast cancer than you did if you were not on hormones. Even though we know all of these things, doctors were telling women to get off their hormones, and they were saying that if you don't get on the hormones within that 10-year window, it's too late for you and you can't have hormones anymore. And I want to explain why that is, because I feel really strongly that that is doctors doing a huge disservice to women. And that is the standard of care in medicine. Like, every doctor is taught this 10, we call this the age hypothesis. And so if you're more than 10, the timing hypothesis, if you're more than 10 years past menopause, you are no longer a candidate for hormone replacement therapy. So the reason is that in that, back in 2002, that darn study that messed everything up, we did find that when women were older, if they were more than 10 years past menopause, they did have more heart attacks and more strokes, but we were giving them a pill that increased their risk for heart attacks and for blood clots. And a blood clot in your heart is a heart attack. A blood clot in your brain is a stroke. So it wasn't surprising that in these older women who had a greater risk for those things anyway, if we give them a pill that boosts the risk, they have more of these things. So that's where the timing hypothesis came. But there was a humongous study that was published. They looked at over 1 million women over 65 who were on hormone replacement therapy. And what they found was all these women over 65 on hormone replacement therapy weren't having more problems. They lived longer. They had less heart disease, less dementia, less hip fractures. They did better, not worse, by staying on their hormones. There are also studies that show if we give women the kind of hormones that don't increase the risk for blood clots, which we should be doing that anyway to all women, there are lots of benefits for cardiovascular health. So when women are older, we have greater risk for heart disease. When we're premenopausal, our risk for heart disease is a lot less than men because estrogen is protecting us. After menopause, the risk for men and women becomes the same, and because of the loss of estrogen. So if we can keep women on estrogen, we can protect them. The challenge that we have is if you're more than 10 years out from menopause, now you've had a chance for some heart disease to creep in, and now we start you on estrogen therapy. The estrogen starts to change the plaque in your arteries. We call it remodeling. It's kind of helping it. But in the process, it gets softer, and a little piece of the plaque could break off and become a blood clot. In that original study with the ones that increase the risk for blood clot, what we saw is in the first year of being on hormone therapy for the older women, that there was an increase in the risk of having this little piece of plaque break off and causing a heart attack. If you did not have something like that happen within the first year on hormones, then every year the risks got better. They went down and you got better and better and better, and it protected your heart. But because of that little uptick, all women are told that, you're not a candidate if you've been more than 10 years past menopause. It's really a shame. I would say that if women are more than 10 years past menopause and they come to see me, I do things a little differently. Like I sometimes use lower doses and do it more gradually. I'm more likely to use vaginal estrogen and much less likely to use estrogen by a pill. I don't generally use it for most people, but I definitely wouldn't for older women. So we do things differently. We need to have a whole conversation. We need to talk about the risks. We need to talk about the benefits. But this is a conversation that women are not able to have with their doctors because of how we are taught. And it's because we're still scared of breast cancer. We doctors still scared of breast cancer, still think that hormones cause heart attacks and cause strokes and cause blood clots. It's just such a shame for women.
This is why I'm so thankful for your work. Are you familiar with Dr. Berkson's work?
Lindsey Berkson? Yes.
Yes. The reason I bring her up is because she was on a podcast talking about how she was flying all over the world giving seminars. And I was like, yeah, a lot of doctors do that. Like, why is she bragging? And then I learned she was 76. And I was like, oh, her voice doesn't sound like I would put her at 40 or 50. Why does she sound so young, Deb?
Well, because she's been on bioidentical hormones for, 30 years. I don't know how long she's been on them, but she kayaks all the time. Like, she's very physically active and she's energetic and her brain is sharp. She reads the medical research every day and shares the findings with the rest of us because we don't all have the time to sit there and read all those studies. And so she makes a point of doing it and sharing the data. But yes, and I remember reading an article where the doctors were really poo-pooing hormone therapy. And one of the things that they're writing about some patient and telling the story about the patient came in and she'd been on hormones and she wanted to stay on her hormones, and they're kind of poo-pooing the whole thing. But when they wrote out her physical exam, what they wrote about the lady was, she's 65 years old lady who looks much younger than her stated age because she's on hormones.
I love that you're sharing these stories. It goes back to what you said earlier. There are estrogen receptors, hormone receptors all over our bodies. Let's dive into testosterone now.
Okay.
Why should we consider testosterone replacement? Are we going to get big and bulky?
I know everybody's worried that they're going to gain too many muscles and grow a beard. The reality is women have more testosterone than estrogen, sometimes up to 10 times more testosterone than estrogen in our body. And women are really shocked to know that. It's just that men have a lot more testosterone than women do. But testosterone is a really, really important for us. Testosterone helps to keep our muscles and our bones strong. That helps to prevent us from becoming frail little old ladies and snapping like a twig when we fall down. Testosterone, of course, is really important for everything to do with sex. Thinking about it, caring about it, like having the idea pop in your head in the first place, for arousal, for vaginal lubrication. It's important for all of those things. It's a very anti-inflammatory hormone. Women who have like a lot of aches and pains, even women who have autoimmune conditions often feel a lot better when we restore testosterone because of the anti-inflammatory properties. But another really important way that testosterone works for us is on our brain. So all of the hormones are important for our brain. Estrogen is like a natural antidepressant. Progesterone is like a natural anti-anxiety. And testosterone is a mood stabilizer. So they know partly why men don't necessarily cry at the movies the way we do. But it is also our motivation, our confidence, our get up and go and get things done, our competitive drive and self-esteem. Men have a lot more than we do. That's kind of why they want to like conquer the world. But we need a little bit of that. When testosterone levels start to go down, a lot of women will describe themselves as just feeling kind of blah, kind of, just sort of not necessarily like depressed in the way that we're like sobbing and hopeless in the corner, but just kind of And we make our way through our day. We put one foot in front of the other. But if something doesn't have to be done today, if it has to be today, we'll find a way to make it happen. But if it doesn't have to be today, a lot of times we just kind of procrastinate or we just not really feeling it. Sometimes we don't go out and meet our friends, or we don't feel like going to the gym or doing the hobbies or the things that we used to like to do, or we go through the motions with our job. Like we used to love it and we used to have passion and creativity, and now we're just like, get the report done and hand it in. And so it changes how we feel. And when I describe this to patients sitting in front of me, they all sort of go like this, like everybody kind of resonates with like, oh my gosh, that's so me.
When it comes to testosterone, how can we take it? How often should we be taking it? Let's dive into that.
So for all of these hormones, I think the first step is to get your hormone levels measured, because you don't even know if you need it. Testosterone is one of the ones. Some women have too much testosterone. You don't need to take more. That would be a problem. But for some women, their testosterone is low. And it's really common for women in our 40s. Testosterone is one of the ones that goes down early. So when we're in this perimenopausal time, we don't really understand why we're being a Karen or, worrying about things or whatever. But if your testosterone level is low, and low is something we should talk about, because the lab range for a lot of these hormones is really wide, and you're going to land somewhere in the normal range, and you're going to be told that you're normal, but that doesn't really mean that you're in a healthy, optimal range to feel your best. So testosterone is one of those. In fact, free testosterone is the test that really tells us how much of the testosterone you can feel. And on a lot of the labs, that goes down to 0. So there is like no low testosterone for women, no free testosterone. It's always going to show in the normal range, which is not fair. I don't know who made it up, but it's frustrating. If you are lower than you should be, not optimal, and you have symptoms, we can replace testosterone, but there are a few things that we can do ahead of that. Reducing stress, letting cortisol calm down. Cortisol and testosterone are kind of opposites. If cortisol is high, it shuts testosterone down. And if we can calm your stress, sometimes it can make it better. DHEA is a natural hormone that comes from your adrenal glands, like the cortisol does. It is the hormone that your body uses to make testosterone. So sometimes we can give you a little extra DHEA. Sometimes that's enough to be able to boost your testosterone, at least for a while. But then we can give you testosterone. It comes in different ways. You need a prescription from a doctor for testosterone and for estrogen, but it can make a really big difference. And all of these hormones, they're kind of like Goldilocks. You need to have the right amount. So too little and you don't feel good. Too much, you don't feel good either. We need to make sure that it's a right amount for you. So you should feel good without having to put up with a lot of side effects.
So we can't do anything for free testosterone because 0's normal, but we know it's not normal. What about total testosterone?
So we have different ways, different tests we can even do, right? We can do saliva testing, urine testing, blood testing. So blood testing, the range is so different on different lab tests. So depending on what lab your blood gets sent to, it's going to have very different ranges. So there are some lab tests that say like 4 to 40 is the normal range. Other lab tests will say normal goes all the way up to 85. What I generally look for, and this is just my opinion here, is if a woman's testosterone level is below 20, and she has symptoms and isn't feeling good, I generally just say your testosterone is low. If it's between 20 and 30, I generally say, like, it's kind of borderline. And if she's got a lot of symptoms, if this is the case, maybe we try to naturally boost it, but it's not really where it should be. If it's over 30, or if she's really not having symptoms, then I'll generally say that it's okay. But, we still follow along and make sure that she's feeling good.
Can we measure estrogen and progesterone in the blood too?
So we can. This is a really controversial topic amongst the practitioners who do the hormone testing. We have saliva testing, we have urine testing, and we have blood testing, and they all give us different information. And I use all three of these tests, but it just depends on the circumstances. Saliva testing is wonderful for cortisol. It's also interesting for progesterone, especially for perimenopausal women where we think that their estrogen is probably okay, but their progesterone is going down. Because for most of the labs, the normal range is set for women who feel good and aren't having symptoms. Whereas on a blood test, the normal range is so big that, you're going to land somewhere in the normal range. The urine test tells us not just what the hormone level is in your urine, but it also tells us how your body is breaking down the hormones into the different byproducts. And that can be a really helpful piece of information. And I often like that one in women who have things like fibroids or fibrocystic breasts, or things where we think like the estrogen and progesterone are not in good balance. When women are full on menopausal and we really believe that their hormone levels are going to come back low, blood testing actually is fine. If your hormone levels are low, your hormone levels are low. It doesn't really matter if it's the free hormone or the total hormone. Low is low is low. And, a lot of times we can just get that covered under health insurance. It comes back quickly. So there's pros and cons to all the tests. None of them is right or wrong. I help train a lot of doctors to learn how to work with bioidentical hormones. And it's confusing for them to try to figure out which ones to use. But what the advice that I would give for women is, if you can find yourself a practitioner who can help you by measuring the hormones, let them use the test that they choose, that they feel the most comfortable with, because truly the most important part of all of this is the interpretation of the results. So if they have a test that they're used to using and, this is what they've got experience with, that's the test that you want for them to do with you.
A follow-up question on the testing. Is there a specific day of our cycle we need to get tested if we still have a period?
Yes, if you have a period, it matters so, so much. The time that we want you to get it is day 19, 20, or 21, which is approximately 1 week before your next period is due, because that's the time in your cycle where progesterone should be nice and high after you've ovulated and before your period. Your progesterone and estrogen are both going to be really low when you're on your period. They're still going to be pretty low the week after your period. Estrogen skyrockets when you ovulate. If you get your blood work done or whatever test done at a different time in the cycle, we're going to get very different results, and we have to interpret them properly.
As we age, women typically put on 20 pounds. It's just harder for women to age. How can we keep the weight off or start losing weight?
The average woman, like you said, gains 20 pounds. Estrogen is what gives us our waist. So when we go through menopause, we start to get thicker. Women complain about belly fat. Like, it's just one of the things that we hate the most about going through menopause. But it really does get harder to maintain our weight. Part of what happens as we age is we lose muscle mass. Our hair gets thinner, our skin gets thinner, our bones get thinner, our muscle gets thinner. And muscle is really important for blood sugar regulation and insulin sensitivity. Also, when we go through menopause and our hormone levels go down, insulin just doesn't work as well. And of course, insulin is a hormone that regulates our blood sugar. And if our blood sugar is not well regulated, if the insulin isn't working well, the way that our body responds is by making more and more insulin in an effort to try to get our blood sugar under control. At this stage, what happens is your blood sugar looks fine and your doctor says, congratulations, everything is normal. But it took a lot of extra insulin in order to get your blood sugar down. And all that extra insulin is a problem because insulin is the fat storing hormone. And so 24/7, it's telling your body to store more fat. And you might be walking around the block and chewing on celery sticks and doing everything you can to burn the fat and lose the fat. But all that insulin is keeping it locked inside your cells. It is a very common experience that women have a harder struggle with their weight as we get over 40 or so. It doesn't mean that you can't lose weight. It's not that this is a hopeless circumstance, but it definitely is a bigger challenge. And it's because our hormones are what dictate whether we store calories or whether we burn calories. also, our hormones dictate where we keep the calories, where our fat gets deposited. And so one of the big things that changes as we get older is where we put the fat changes. So like our body composition changes. We get more visceral fat, which is that internal fat that's associated with inflammation and heart disease. Hormones play such a tremendously important role in women's bodies. Getting hormones back in balance just help us get back to being a healthier version of ourselves. We feel like ourselves again. Our metabolism can come back online. Our brain can work again. We don't have to feel old and achy. It really is just an important piece of keeping us healthy. And, if I can just give you one little story here, a lot of people will argue that menopause is natural and that our hormones going down is just a natural phase of life. But, we didn't used to live very long, right? So menopause was kind of around the time of the end. And now we live decades past menopause. As we get over 40, a lot of times our vision changes, right? Like we have to start holding the piece of paper farther away in order to be able to see it. But you don't go to the eye doctor to complain about that and have them tell you, well, this is just natural. You just need to get used to this. You just won't be able to read things anymore because your eyes have changed. Instead, we say, here are your reading glasses so that we can correct your vision so that you can continue to be a productive member of society. And so hormones are kind of the same way. All of these things that we've talked about, the irritability and the not sleeping and then can't lose weight, all of this kind of stuff is very manageable if we can get your hormones back in balance.
One of my favorite questions to ask is a real life example. So I know you spoke about Lori earlier. Can you give us another example of someone who came to see you with some of the symptoms we've been speaking about today?
Okay, so one of the patients that really stands out for me is somebody who, when she came in and sat down, she was so mad. Like she was just so agitated. And I knew that she wasn't mad at me. She hadn't even met me yet, but she was so mad at her circumstances because she was somebody who could not lose weight. She was doing all the things. She was not eating any of her favorite foods. Like she was doing everything right. Nothing was budging. And she was so exhausted and she felt terrible. So she went to her doctor because obviously something had to be wrong. And he ran all the tests. That's what she told me. He did all the blood work and came back and he, sent her this portal message to say, hey, great news. Everything is normal. And she called him up and she was mad at him because how can everything be normal when she felt so bad? But her blood pressure was normal. Her blood sugar was normal. Her cholesterol was normal. Like all his labs were normal. His wife was a patient of mine and was feeling a lot better. So he referred her to me because he didn't really know what else to do with her. And the reason that she was so angry when when I walked in the room is because she really didn't have hope. Like she thought that he'd already done all the things. She'd already done all the things. And she was so scared that like this was it for her. Like it wasn't going to get any better. When we did our evaluation, we found all kinds of things. Like she was already on an estrogen patch, but she wasn't on progesterone because she'd had a hysterectomy. Nobody offered her testosterone. Her cortisol was really high. Of course, that causes you to gain belly fat and causes insulin resistance. Even though her blood sugar was normal, her insulin was too high. Nobody had checked that. She was deficient in B12. She had some hidden food sensitivity. She had a lot of inflammation in her body. Like we found this list. And once we got all of those things restored, she lost 40 pounds and she felt like a completely new person.
Oh,
And I just think it's a really great example of she wasn't exactly sick, but she sure as heck wasn't well. And it was just her suffering was so unnecessary.
oh, that's such a great story. Dr. Deb, I've been waiting to ask you this question all day. If we start bioidentical hormone replacement therapy, do we need to take them forever?
What a great question. So we used to tell people, take them for the shortest amount of time possible, get off them. But what I would say is for doctors like me, we sort of feel like you're just going to bury us, in our casket with the hormones still in our system. You can take the hormones just as long as you want. I think the good news is they're always optional. If you don't want to take them anymore, you don't have to. Nobody has to take hormone replacement therapy. But if you're on hormones and you're having benefits, we always take the risks and benefits for everybody into account. But if you're having benefits, you can stay on the hormones. We generally tell people you should notice something within 30 days. It might not be perfect within 30 days, but if you get to the 30-day mark and you can't tell one darn bit of difference, then it means we got to change things up. So generally things can happen pretty quickly. But of course, over time, the benefits continue to get better.
Amazing. As we wrap up this conversation, I ask all my guests the same closing question, which is, what haven't I asked you that you'd like my listeners to know?
I think what I would like for everybody to know is all of these symptoms, you don't have to put up with it. Hormone therapy is so, so important. And, sometimes you have to find the right practitioner in order to be able to help you. So don't give up if your regular doctor, your regular gynecologist or whatever just isn't interested in talking to you about hormones. It hasn't been taught at medical school for a long time. It's not their fault. But even before the hormone therapy, there's so much that you can do for yourself. So what we typically do is we start women on like lifestyle changes while we're waiting for the hormone test results to come back. And a lot of times by the time they come in to get the hormone test results, the night sweats are better, their mood is better, their bloating is already better. So there is a lot that is within your own control. And I believe that living well is the best medicine.
Oh, I love that. I feel like it goes hand in hand with Welcome to Wellness, living well.
Exactly.
We're on the same page, Dr. Deb. Can you please tell my listeners where to go to find out more about you?
My office, Signature Wellness, is in Charlotte, North Carolina. And we get asked all the time, like, do you do telehealth? But we need people come and fly in one time to see us, and then we can do things by telehealth afterwards. Our website is signaturewellness.org. There's lots of information on the website. And I have a book that I would like to give away for free. The book is called This Is Not Normal, A Busy Woman's Guide to Symptoms of Hormone Imbalance. It's got lots of checklists. Could you be low in testosterone? So you can kind of figure it out by doing the quizzes. Then there's some information about some of the natural things that you can do to get started. There's information about how to talk to your doctor to try to at least see if they can help you. And then if that's not working out, there's some resources for where you can find somebody that can help you. And you can get a free copy of the book at isityourhormones.com.
Amazing. Oh my gosh. Thank you so much for coming on the show today. We'll put everything in the show notes for where people can find you. Thank you so much.
Thank you.
Thank you so much for listening today. If you enjoyed today's episode, a quick shout out on Instagram or leaving a review would make a positive difference. Or even better, share this podcast with someone you think might benefit from this information. You can get in touch with me on socials. I'm most active on Instagram. My handle is Ashley_Deely. Until next time, this podcast is presented for educational and exploratory purposes only. The published content is not intended to be used for diagnosing or treating any illnesses, disease, or disorders. Those responsible for this show disclaim any responsibility for any possible adverse effects from the use of this information presented by myself or my guests. Please consult with your healthcare provider before using any products or services referenced in this podcast. Episodes on the Welcome to Wellness podcast may at times cover sensitive topics, including, but not limited to, depression, suicide, 5G, nootropics, circumcision, birth control, the Women's Health Initiative, the use of plants medicine, abortion, geoengineering, terrorism, gender, AI, and sex, drugs, and rock and roll. You are advised to refrain from listening to this podcast if you are likely to be offended or adversely impacted by any of these topics. However, if these topics interest you, you just may have found your tribe. The information or opinions expressed on the Welcome to Wellness show are solely the views of the individuals involved and by no means represent absolute facts. Opinions expressed by the host and the guest can change at any time. The views of my guests are solely their views, and the Welcome to Wellness show does not accept responsibility for them. Any action you take based on the information contained within this podcast is strictly at your own risk. The Welcome to Wellness host, Ashley Deely, will not be liable for any losses or damages in connections with the use of this podcast. You should take all necessary steps to ascertain the information you receive in this podcast is correct and has been verified. None of the guests or contributors on the Welcome to Wellness podcast will be responsible for your use of the information contained therein. Under no circumstances will the Welcome to Wellness show or my affiliates, partners, suppliers, licenses, or guests appearing on the show be liable for any direct or indirect consequences or damages arising from your ability or inability to access this podcast. All intellectual property rights belong to me, Ashley Deely, and include, but are not limited to, the copyright and any other rights in the design. You are permitted to use the Welcome to Wellness podcast for personal use, but not for commercial use without license. You may not make recordings. If you breach these terms, you lose the right to the Welcome to Wellness podcast, and you must destroy or return any copies or recordings you've made. Guests on the Welcome to Wellness podcast may at times provide information or read extracts from third-party copyrighted work. The Welcome to Wellness podcast does not provide any medical or professional advice within these episodes and should not be used as a replacement for medical or clinical care. If you take any action or inaction as a result from the content you consume within the Welcome to Wellness podcast, this is based solely on your decision, and Ashley Deely and the Welcome to Wellness podcast host and my guests cannot be held responsible or liable for any of the consequences of such action or inaction. Thank you.